Wonderful. So hi, everyone. Hope everyone is well. I am doing well. I'm so excited. Every Wednesday night, I get to bring new life and birth and usher new life into the world. I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakanna, and I'm an obstetrician gynecologist. So every Wednesday night, you get to hear from me at the hospital, and I want to welcome all of our guests. I want to welcome all of our business partners. And tonight we're going to be talking about how CBD affects your hormones. I am hoping, I am praying that all of my business partners that ask me month after month, does CBD help with hormones? I'm hoping that you guys are on the line. If not, no worries. This is always a recorded webinar, but we want to really talk about how CBD affects your hormones. But I promised you, every Wednesday night, we spotlight an African American female physician, pioneers in the field. And I'm excited because I get to learn as well when I introduce these physicians every week. But Marilyn Hughes Gaston is the reason why we have newborn screening tests for sickle cell anemia. Yes, this is the woman that did the research and found that it is really important that we screen all newborns, African American newborns, for sickle cell disease. And this is very dear to my heart because I lost my nephew 2 years ago to sickle cell. So Marilyn Hughes Gaston, in a pivotal experience when she was an intern physician working in Philadelphia, she got a patient, a baby that was admitted with a swollen, infected hand. And guess what? Her attending physician did some research and found out that this baby had sickle cell anemia. From that point, she devoted her career to do research in sickle cell anemia. In fact, she was named the chief of staff in sickle cell disease branch in the National Institute of Health. She is the one that, again, discovered that all newborns should have sickle cell screening, because if any of you are on the line and had children, there are newborn screening tests that are done on all babies. And so she's the reason why the sickle cell anemia screening was done in 1990. She became the very first Black female physician to be appointed director of the Health Resources and Service Administration Bureau of Primary Health Care. She was also the second Black woman to serve as Assistant Surgeon General, as well as achieve the rank of Rear Admiral in the U.S. Public Health Service. So Dr. Gaston, we spotlight you, we honor you, and we thank you for all of your research in the field of sickle cell anemia. So let's move on to our topic for tonight. And our topic tonight is CBD and its effect on hormones. And this talk tonight is just not for women as it relates to hormonal changes during menopause. This topic tonight affects all of us. We all have endocrine glands. That means we all have glands that modulate and regulate our blood pressure, our emotions. Well, there's some hormones that we don't have. All men have testicles. Women don't have testicles, and men don't have ovaries, but women have ovaries. But outside of that, we all have other endocrine glands in common, like the pancreas, the thyroid, the thymus, the adrenal gland, and the pituitary gland, and the pineal gland. So again, hormones are just molecules, and they're produced in these different glands. And what they do is they act as chemical messengers. So they travel from specific receptor sites in the tissue and organs via the bloodstream. So these glands are important for emotions, for growth, for your body temperature, your metabolism, your reproduction, and even your blood pressure. So when we have a deficiency in any of these hormones that these glands produce, guess what happens? It causes health problems, right? We all know that diabetics have a deficiency or dysfunction in the organ called the pancreas. We all know that many people who have thyroid disease, they may have hypothyroidism or hyperthyroidism. They have a deficiency or overproduction of hormones that are produced in the thyroid gland. Adrenal gland, that's a big gland we're going to talk about, because when we get stressed out, we have cortisol levels that are off the charts. And so all of these endocrine glands are really important in the production of hormones that help our bodies work more efficiently. Now, there's other hormone imbalances, and those hormone imbalances, some are very common for both men and women, and they may experience symptoms depending on the hormone and the gland that's affected. Many of you may remember that we did a whole series on male menopause or andropause. So yeah, you men go through the same challenges that we women go through when we have a hormonal imbalance later on in life. So for women, you know, menopause or that hormone imbalance that's associated with menopause can cause a lot of really troubling symptoms like forgetfulness, hot flashes, oh my God, hot flashes, mood swings, nausea, heart palpitations. In fact, I don't know if you remember, but Oprah Winfrey, when she was going through menopause, she actually thought she was having a heart attack. Then she thought she was having thyroid issues, because not only was she having heart palpitations, but she was really having a hard time losing weight, right? And us women, we're known for blaming our thyroid gland for making us gain a lot of weight. But it's really the hormonal imbalances that you'll learn tonight that causes that bloating, that weight around our waistline during menopause. It also can cause irregular periods, vaginal dryness, joint aches and pain, mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss. We all know that these hormones, when they become deficient, can cause these sets of symptoms in women. But how about men? Men go through the same exact condition called andropause, when they have hormonal imbalances with their testosterone, right? Us women have hormonal imbalances with our estrogen. For men, they have a decreased motivation, lack of focus, low energy, muscle loss, erectile dysfunction, and muscle loss again. So how do we really understand hormone imbalances? You know, hormones fluctuate. We do know. We have high lows, and we see that specifically in women during the menstrual cycle, during reproductive age women. But then there's also hormone imbalances that affect the endocrine glands that really cause very serious health issues. We talked about some of them, one being thyroid conditions, diabetes. There are other conditions that can affect your heart because of hormonal imbalances. Being overweight, it can start to affect your mood, your sleep and wake cycle. So all of these hormonal imbalances not only are triggered by health conditions, but they can be triggered by the environmental and lifestyle factors as well. So being stressed can affect your hormones. That's why you have to wasu down. That's why you have to really think about some holistic organic products that you can start using. Taking steroids, being overweight. These are just a few factors that may also cause hormonal imbalances along with those endocrine organs not working properly. So how does CBD affect your hormones? How does CBD affect your hormones so that they would be more in balance? So everyone has experienced hormonal imbalance at some point in their life. They've experienced anxiety, they've experienced stress, insomnia. All of these conditions are because of either a hormone imbalance with serotonin, dopamine, melatonin. I know you've all heard these words before, but they really do play a significant role in our health. Studies have claimed that CBD may help with restoring hormonal balance. How does it do that? By interacting with the central nervous system to calm anxiety and to reduce inflammation, just to name a few. So let's first discuss what CBD is. You may be a guest on the line and you may say, Dr. Rita, what are you even talking about? Because 4 years ago now, I had never heard of CBD. So let's talk about the cannabis plant to better help you understand what CBD is. So the cannabis plant produces over 100, maybe 130 compounds called cannabinoids. And this plant has 2 species. One species is called the hemp species, and the other species is called marijuana. Now, many of you have heard of marijuana before, but many of you have probably never heard of hemp. Maybe hemp seeds or maybe hemp and lotion, but not really understood the fact that the hemp species comes from the cannabis plant. And what makes the hemp species such a desirable species to use is that it has high levels of what we call CBD or cannabidiol. It's part of the plant that gives us a lot of health benefits without the high. So marijuana, though it also contains the CBD, this healthy part of the plant, it contains large amounts of THC. And THC is a part of the plant that gives you the high. It gives you the paranoia. It gives you the euphoria. It gives you the munchies, right? And that part of the plant, because it has a very high level of THC, we call that part of the plant or the species marijuana. So yes, marijuana does have some medicinal benefits, but it's really the hemp, the species hemp that has very high levels of CBD, very trace amounts of THC that gives you the health without the high. And so it's CBD from hemp is all the craze. It's mainstream. We see CBD products everywhere now, right? We see them at the grocery store, at the smoke shops, at the gas station. It's in a lot of lotions and shampoos and skincare. You're seeing CBD being infused in smoothies at health food stores. So really it's important that you understand that yes, there's a part of the plant that gives you the health without the high, that studies have shown that helps improve or balance hormones, all those hormones that we talked about earlier. And the way that CBD balances your hormones is through the endocannabinoid system. Now, the endocannabinoid system is a system we all possess. If you have a spinal cord, you have an endocannabinoid system. And this system is the most vital regulatory system in our body. In fact, it modulates, it regulates all the hormones. It helps in appetite, in digestion, in metabolism. It helps with our blood pressure, our pulse rate. It helps to reduce inflammation and pain. This endocannabinoid system helps to balance the immune function. When we talk about autoimmune diseases like lupus and fibromyalgia, multiple sclerosis, these autoimmune conditions are really attacking different organs in our body. Our immune function is hyperactive, and this system brings it into balance. The system also balances energy. It helps to balance thermogenesis. It helps with memory. It helps to modulate learning and movement. You know, those who have Parkinson's disease, movement disorders. It helps to regulate stress and mood and sleep-wake cycles. So this endocannabinoid system is how CBD works. So when you ingest CBD, this system has receptors that CBD binds to and sends signals to different endocrine organs to put the hormones back in balance. So it's fascinating. The science is there. I think that when we talk about those who are diabetic, CBD interacts with these receptors in the pancreas that help to influence insulin levels. Insulin is the hormone that helps to bring down blood glucose. CBD also interacts in this system with the pineal gland. We saw that little gland on the last slide. That gland is important in producing melatonin. Melatonin helps us sleep. It also interacts with the receptors in the adrenal gland. That was another endocrine organ, right? And the adrenal gland produces cortisol. And cortisol is really, when it is out of control, I'm telling you, cortisol is the reason why you're stressed out. And cortisol is the reason why you can't get that unwanted COVID weight off of you, right? It's because of that cortisol. So when we look at CBD and hormones, we look more in depth with insulin. We see that CBD not only is an anti-inflammatory, it helps to reduce inflammation in those beta cells, but it also helps to lower blood glucose. And again, it lowers blood glucose by providing those receptors to be put back in balance so that those cells in the pancreas can produce insulin. By producing more insulin, we're able to lower blood sugar. We're able to help reduce those diabetics from having those threatening conditions that are comorbidity to diabetes, like obesity and heart disease. So it's a fascinating system. It's scientifically proven that CBD absolutely helps to produce a hormone in the pancreas called insulin. Let's look at stress, because I'm telling you, stress is at its all-time high. And stress is produced by a hormone that the adrenal gland makes, and that's called cortisol. Cortisol is responsible for the mind and body reaction to stressors. You know, when you are stressed out, that adrenal gland is full throttle making a lot of cortisol. When cortisol levels are high, then your body is dedicating more resources to manage stress, and it's neglecting other parts and important functions of the body. So it is now not being able to maintain a healthy metabolic rate. It's hard to lose weight. It's hard to reduce that stress in the body. So CBD can effectively, by working in the endocannabinoid system, binding to receptors in the adrenal gland, to help bring down that cortisol level. Melatonin. Melatonin is another important hormone that the pineal gland, that little gland in the brain, makes. Melatonin is a hormone that is really important and responsible for a good night's sleep. And you can see the circadian rhythm here. We all know people who say, oh, I sleep fine, I'm fine, but yet they're fatigued all day. And why is that? It's because they're not getting that restorative sleep. They're not getting into that deep REM sleep that when they wake up, they feel refreshed, they feel energized, they're able to focus. So again, melatonin is produced in the pineal gland, and its main role is to regulate the body's circadian rhythm, the natural sleep-wake cycle. Studies have shown that CBD helps with insomnia. How? It helps by producing and modulating and bringing back in balance those melatonin levels in the pineal gland. So just fascinating how studies have shown CBD can help reduce blood sugar by working with those receptors in the pancreas to produce more insulin. It can help with the adrenal gland to reduce cortisol. And now we're learning that it can help to produce more melatonin in the pineal gland so that we're getting that restorative sleep. How about women? You know, women on the line, we absolutely cannot stand those hot flashes, those mood swings. And men, you absolutely don't like being around us because we're crazy. So there's a lot of studies that show how CBD can not only help balance those hormones during pregnancy, during puberty, during menopause, and even menstruation or menstrual cycles. In North America and Europe, about 75% of women are expected and can have hot flashes. They're awful. It's like a freaking heater up the back of your neck and down your back. It's absolutely awful. You'll see women, they're undressing in the middle of the winter. They have the windows open in the middle of the winter. They have the air conditioner or the fan on in the middle of the winter because these hot flashes can be debilitating. And when we look at menopause, you know, there's really 4 stages. You will meet women that say, I've been in menopause for 10 years. Well, it's really the stages that women go through within the 2, maybe 10 years of their perimenopausal, menopausal, postmenopausal cycle. And what is the culprit? Estrogen. We start to lose estrogen, and as we start to lose estrogen around 35 to 40 years old, this is when we have hot flashes, mood swings, craziness. It can produce other symptoms that can be confused with heart disease, palpitations. It can be confused with mental illness, depression. It can be confused with a lot of different disorders like hypo or hyperthyroidism. So the 4 stages of menopause are something that you really need to pay attention to that absolutely can last from the ages of 35 all the way to 60 or 65. And so there are really a lot of health problems that CBD can address, can assist with for women over 40. CBD has been found in research to assist and help with hot flashes and insomnia and joint pain and low libido. You know, that's a really big problem in women who are menopausal. Vaginal dryness causes very uncomfortable intercourse, which causes a lot of issues with marriages. Menstrual cramps, mood irregularity, osteoporosis, osteopenia. You know, CBD has been shown in research to produce and to help bone growth. And again, painful sex after menopause. So when we go through these hormonal imbalances, it's not pretty, guys. You guys out there know that. And women, it's really frustrating. 1 minute we're happy, 1 minute we're sad. 1 minute we're happy and laughing, 1 minute we're crying. So it's a fluctuation not only in estrogen, but also progesterone. It's also in turns affects the production of serotonin. See, serotonin is that hormone that makes us feel good, that makes us feel happy. Well, there's a decrease in serotonin during these fluctuations in our hormones. So CBD just comes in and puts the body in balance so that the body is not having all these fluctuations in hormones. And the hormones don't just have to be related to women, related to men and their testosterone level, related to men and women who have stress and cortisol level fluctuation, can be related to men and women who have fluctuation in blood glucose and insulin levels in diabetics. So hopefully you get the point that it's all hormones across the board that CBD can assist in putting the body in balance. How does it do it? Again, it does it through the endocannabinoid system. And I had to add this infographic. I'm still hot. It just comes in flashes now. So really, really funny to know that yes, men may think it's very minor, but hot flashes are absolutely debilitating. Another thing women experience is bloating. They may experience bloating during their menstruation, or they may notice an increase in weight around the waistline during menopause. Again, the problem occurs not only because there's a intense uterine contraction that happens during menstruation, there's a lot of pain, but it also, studies have shown that it also slows down the movement of food. And so women during around their periods get bloated. They get very uncomfortable. Again, CBD can come in and help to put the body in balance, reduce the bloating. We talk about how CBD can increase the gut motility. It can help move things along faster. So it really does play a part in colonic intestinal motility. Many of you may know the testimony for my daughter as it relates to menstrual cramps and CBD. She likes to use CBD topically during that time of the month to relieve pain. We know that menstrual cramps come from the fact that prostaglandins increase. Progesterone decreases, prostaglandins increase. See, prostaglandins is that hormone that is released when women go into labor, right? That's why when some women ask me, Doc, how can I go into labor? I tell them to have intercourse, because semen, sperm, has a high level of prostaglandins in it, and it helps to put the woman in labor, menstrual cramps. It may be too much information for this webinar, but it's the truth. It's the prostaglandins that lead to contractions, that lead to cramps during menstrual cycle, that leads to pain. So CBD comes in and it inhibits an enzyme that's responsible to produce more prostaglandins or relaxation and less contraction. CBD also can help reduce inflammation. It can help reduce pain, and that's how CBD helps to relieve menstrual cramps. Is this like exciting? It's like fascinating to understand that there's real science behind how CBD works. It's not a snake oil. It's not a magical potion. It's real science that really helps you and others to understand why it's effective in a lot of these conditions. So get back in balance with CBD. Now let's move on to some products. You know, here at Wakanna, we have to always make the disclaimer that our products, and we can't say any CBD products can be claimed to cure, mitigate, or diagnose any condition, right? What we want to do is educate you every Wednesday night about the science. We want to educate you about the pathophysiology. It's a long word, right? We want to educate you on how the body, when it's not working properly, the science behind how CBD works to put it back in balance. And I think we've done that tonight. We've talked about how CBD works. So we talked about the endocannabinoid system, which is the science. We talked about hormone imbalance. We talked about the different endocrine organs like the thymus and the thyroid and the adrenal gland and the pancreas. All of these, the pineal gland, all of the testicles, the ovaries, all of these endocrine glands can be put back in balance when they're out of balance with the science of CBD. So this is our product line. It's a very vast amount of different products that we offer. There are different ways of consuming CBD. You know, there's tinctures, there's vapes, there's topicals, there's supplements, there's edibles. So there is a vast amount of opportunity for you to use all methods of consuming CBD, or maybe you just want to use some of the methods. Well, let's talk about our tinctures. See, tinctures, they are oils that you place underneath your tongue. And when you put them underneath your tongue, you can absorb the CBD in your bloodstream by holding it underneath your tongue for a minute, for 60 seconds before you swallow. And what is very unique about our products here at Wakanna is that our products have a proprietary formula. So we just don't sell CBD, but our formulators are smart enough to understand that essential oils play a big role in organically giving the body what it needs, putting the body back in balance. So many of our products are enhanced with essential oils along with our CBD. So our 500 milligram Hempranium on the very far left is probably one of our top sellers. It has a proprietary formula that also includes black seed, turmeric, and peppermint. It's 500 milligrams of CBD in that entire 15 ml bottle. We also have a water-soluble product for those who want to put CBD in their water. Maybe they don't want to put it underneath their tongue. Maybe they want to drop it in their water and go, or maybe their oatmeal or smoothie. It's a product that is water-soluble. You can use it in liquid and or food. We also have products that you can bake and cook with. Our 500 milligram Culinary Plus is a great product if you want to bake or cook with CBD. We have another line. We have a power line. And if you see on this slide, the power line are the products in the black label. Those are what we call our full spectrum products that contain the legal limit of THC, which is 0.3% or less of THC. Now, if you have random drug screens and you want to use CBD, you can. We have a product which is in our Pure line. Those are our broad spectrum products. Those are products that contain less than 0.0% of THC. Those are all the products you'll see with a white label. Now, the white label products also have a special delivery, a way of delivering the CBD to the cells, and that is nanotechnology. Nanotechnology makes the CBD molecule more water soluble, which makes it more available to the cells. So our Pure products are 98.7% bioavailable to the cell and at the cellular level. It's a product that you want to use if you have random drug screens at your job. We also have our products that are in a 5 ml bottle. It's a great way for you to test these products before you purchase a 15 ml bottle. And we also have a very high potency tincture. It's our Hempranium MD. And that's the one here. It's between 750 and 800 milligrams of CBD. And I really like reserving that particular product for those who have pretty severe challenges in their life. They have quality of life issues, maybe because they're being restricted in mobility. Maybe they're having some issues with joint pain or mobility due to arthritis, or maybe they're having some issues due to symptoms that autoimmune conditions give, or maybe they're having hormonal imbalances due to issues that diabetes may bring their way. So that Hempranium MD is a great product. When you start CBD, it's important to start low and slow. What does that mean? That means our recommended starting dose for our products are 3 drops under the tongue twice a day. That's a great way to start CBD. Why? Because more is not better. Many people don't need a lot of CBD to put their body back in balance. Many people don't need a lot of CBD to balance their hormones back, right? So start low, start slow. You can always increase that dose if needed. Topicals. Topicals are another great way to administer CBD. I talked about my daughter who loves to use the topicals during that time of the month. During those menstrual cramps, CBD, again, studies have shown that CBD can reduce inflammation. CBD can reduce pain. CBD can reduce those prostaglandins from causing a lot of pain during cramps and contractions. We have products that are 200 milligrams, 400 milligrams, 500 milligrams, but again, our products are unique. They have a proprietary formula where we've infused not only CBD, but essential oils to help enhance the anti-inflammatory, the antioxidative properties that CBD affords us. We have a Power Body Mango Cream, and I'm telling you, more and more testimonies are coming out that this body cream that helps to restore your skin and protect your skin and address symptoms due to psoriasis and acne and eczema. This body cream, we're getting more testimonies that people are using this body cream to assist with inflammation, to assist with pain. So guess what? Dr. Rita started using that body cream on her right shoulder. And I mix it with this 400 milligram Power Pain Cream for that right shoulder. And I also mix it sometimes with this Dr. Rita's rub. So it's CBD, and it makes sense. You know, the skin is the largest organ on our body. And so our skin not only needs CBD, but sometimes those sore muscles and joints need it too. We have another topical product called Empowered Hair. Empowered Hair addresses alopecia, it addresses hair thinning. We see that. We see that in male baldness and andropause. We see it in menopause as we get older. As women, we see our hair thinning. A great product to restore those hormones as well. And then our Oud body oil is another great product. Doesn't contain CBD, but oud is a great aphrodisiac. It's another way of restoring not only the skin luster, but helping those who have hormonal imbalances and low libido as well. Our Smokables, another way to consume CBD. Now, Smokables are fast-acting products, meaning that when you smoke our CBD joint, or you vape one of our cartridges, or maybe you use our premium flower and you roll your own CBD joint, these products work within 1 to 5 minutes. An acute hot flash, maybe an acute bout of depression or anxiety, any symptoms that menopause, andropause, hormonal imbalance, these products can address, they can assist with. We can never say that they can cure these issues, but they can assist with the symptoms. You know, I've got 5 patients who have successfully reduced their nicotine intake. How did I do that? By offering them this CBD joint. The CBD joint, each time they have the craving to smoke a cigarette, they smoke this instead. What does it do? Well, it also works on that pathway where it produces more serotonin. We talk about serotonin, that's that feel-good hormone, makes them feel good. It breaks that awful cycle of cravings for nicotine. So it's a great product for those who smoke as well. And then our edibles, oh my God, our edibles are amazing. We can't keep these gummies in stock. Our power gummies are those full spectrum gummies for those who do not have drug screens, but if you do have drug screens at your job, you can use our pure product gummies. Anything with the white label is safe for those who have random drug screens that are at your job. We also have a flat belly coffee. Our flat belly coffee, again, when we talk about menopause, andropause, we talk about that weight gain is in that abdominal area. Diabetics have that a truncal obesity. This is a great product to help curb your appetite and to get those unwanted pounds off. Again, we have bitters. We have a bitter tea. It's a detox tea. Again, when we talk about hormone imbalances, we've got to detox. We got to detox our system. We have another immune defense tea. We have so many amazing products that can address hormonal imbalance. And then our newest kid on the block, our Flight 50. These are our newest gummies. These as well can be a part of your regimen for those who are trying to address those different hormonal imbalances. Our spices, our butter is vegan, our butter is non-GMO, our butter is not a body butter. My daughter thought it was a body butter and used my butter on her body. So this is a butter that you consume, you put on your toast, you put in your oatmeal. Our spices are amazing. Our chili lime, our garlic, our flavor king. You can consume CBD in so many different ways and be very, very creative in the kitchen, and a great way to put your body back in balance. Essential oils. Essential oils also help to balance hormones. Did you know that peppermint can help assist those who have hot flashes? Yes, peppermint. Take some peppermint during your next hot flash, put it in the palms of your hands, and inhale that peppermint and watch that hot flash be addressed. So essential oils, there are studies that essential oils are great natural remedies that can really benefit all of us women who are going through menopause, and even men who are going through andropause. We have a whole line of love products. We have a whole line of products that really help to address libido. It helps to address vaginal dryness. It helps to address erectile dysfunction. So if you're a guest on the line, I really, really, really want to make sure that you have time. I'm going to answer some questions, but you have time to contact the person that invited you, because we can be on the line for 2 more hours talking about all of the products that we have that CBD has been found in studies to assist with those who have hormonal imbalances. So hopefully you've learned a lot this evening. Hopefully you understand that a hormonal imbalance doesn't just mean women who are going through the change, but it affects all of us. We're all under stress. I bet our adrenal glands are working 1,000,000 times over right now during this global pandemic. We all get lack of sleep, right? That pineal gland is not producing enough melatonin. We all have friends and family members that struggle with diabetes, blood sugar levels being too high. You know, the list goes on and on and on. And hopefully now you understand that yes, CBD can assist with those who have hormonal imbalances. So I'm going to take some questions. And I'm going to make sure that whoever invited you tonight, they really love you. They really wanted you to get this information so that you can address your health in a holistic, organic, natural way by really using a lot of these products. Many of these products can be interchanged and added and taken together, and you really want to use our essential oils. Essential oils are old herbs that, yes, address hot flashes and mood swings and energy levels and hormonal imbalances as well. So I'll take some questions. If there's no questions, please contact the person who invited you. Get your questions answered. If I don't answer them this evening, get those products ordered. And we're excited to have you join us this evening. And join us every Wednesday evening. Every Wednesday, we talk about a different topic. We really want to help people know that this plant, there shouldn't be a negative stigma around this plant anymore. This plant has been used for thousands of years medicinally and has helped thousands of people throughout many, many, many centuries.
There are some questions in there.
Okay, wonderful.
Robin says she wished she knew this 40 years ago.
Oh, yes. Right, Robin? All these
Stacy
hot flashes.
Stacy says, "What kind of products got my body back in balance?" Um, Gaining so much information out of where how CBD can assist in particular issues surrounding hormone imbalance. Awesome. So your question was answered. Somebody did pick up something.
Yay.
Um, I have to microdose myself because my menopause can be truly intense. Do you have anything to speak on that?
Um, I do want to say that with menopause, you don't want to forget about your diet and exercise. I notice that when Dr. Rita's bad and Dr. Rita's had sugar, I don't mean like taking sugar and eating it. I mean those hidden sugars like in pasta and white products that we shouldn't be eating. When I get hot flashes, now I notice that it happens after I've consumed a large amount of things I shouldn't be eating. So you want to make sure that your diet is plant-based or it is close to being plant-based and you're limiting your sugar, that you're getting your exercise, you're getting your rest, and you're using the products. You know, the products become magical when you make those lifestyle modifications and those changes. I don't even know if I answered the question. What was the question again, Kevin?
Well, I was just asking you to speak to the fact that she said that she microdoses because of menopause. I think you did, and
Oh,
that leads into the very next question, which is which products would you suggest for really bad hot flashes?
so microdosing, I do want to mention what microdosing is for those who may not know what that terminology. Microdosing is when you take a little CBD every hour. You can microdose every hour. You can do it really, really slow by taking a drop every hour and figuring out where your symptoms start to abate or you see resolution of your symptoms, which dose that is or how many drops that is. That's a really slow way of doing it. It's like you're finding your sweet spot. You're finding that area that really addresses the symptoms. Is it 6 drops? Is it 7 drops? It takes a while, but a lot of people will microdose. For really, 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 really bad hot flashes, definitely I would make sure I'm looking at my diet, right? Because if you use our amazing products and you still have a bad diet, you're drinking Pepsi every day, you're drinking Coke every day, you've got that Dunkin' Donuts donut every day, you got to take the sugar out of your diet. I actually don't know why hot flashes worsen with sugar. I need to do that research. I've never done that research as an OB-GYN, but it really affects hot flashes. So I would start out with Impranium MD. That is our highest potency product. I would start out with 3 drops twice a day. I would get our pure gummies. Those are the white label gummies. And I would take a gummy with those 3 drops of the Hempranium in the morning, one gummy with that Hempranium in the morning. And I would take another gummy midday, that pure gummy. Now, the gummies do have a little sugar on it, not a lot, not a lot, just 2 milligrams, not a lot of sugar. No, nowhere near that donut or that other stuff we're eating, Snickers, right? Just a little sugar. So it's not going to worsen those hot flashes. So Impranium MD, 3 drops twice a day, a pure gummy in the morning and afternoon. And then at night, I would use the power gummy. The power gummy, it's got that little bit of THC that's going to help you sleep at night. See, those hot flashes can wake you up in the middle of the night. You're soaking wet, you're miserable, you are mean, you're evil, you've got all the windows open. We want to reduce all of that. So when you say really, really, really bad hot flashes, those are probably the ones that have you soaking wet at night and you can't sleep because you're hot. And we want to make sure you're sleeping well because when you sleep well and have that restorative sleep, you're energized during the day and you have energy. Many women who have really, 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 really bad hot flashes are always fatigued because they're not getting a good night's rest. So Hempranium MD twice a day, 3 drops twice a day, 2 pure gummies during the day, and then 1 or 2 at night to help you sleep. That's where I would start. I would also get our peppermint. There are so many studies that show peppermint, inhaling peppermint during a hot flash helps to reduce those really quick. So I would get that peppermint, and I would also have a vape cartridge. I always love, in fact, here's my vape cartridge. I'm here at the hospital and I have my vape cartridge. That vape cartridge is going to give you, where's my vape cartridge? Oh my God, where is it? That vape cartridge is going to give you that acute resolution that you're looking for. Kathy, I better have my cartridge.
Don't panic, it's there. I know you have it.
I've got my joint, but I don't have my cartridge. It's somewhere.
Check your pocket. Check your pocket.
That cartridge is going to help during those acute conditions, instances where you need fast relief. Where's my cartridge stuff? Oh, there it is. Woo!
I knew you had it.
I was really, really very nervous. You know, I don't know why I chose, but I love OB. It's my mission. It's my ministry. But I chose probably one of the most stressful fields of medicine and highly litigious fields of medicine, OB-GYN, right? Not all babies come out alive. Not all moms make it through childbirth. So I always have my cartridge here for those really, really stressful deliveries, when we lose a mom in childbirth, you know, et cetera. So it's not always like reality TV shows it, where everything comes out good and good outcomes. So absolutely having a fast-acting product always on in your reach, in your bag, in your purse, in your pocket is very, very necessary. So really, really bad hot flashes, Impranium MD twice a day, the Pure Gummies twice during the day, Power at night, and a cartridge.
That sounds like a good remedy. I have one in my car and my purse.
Yeah.
What is the safe amount of CBD to consume at one time? I understand we are to start low and slow in the beginning, but what's the safe amount to use at one time?
Well, for the first week, anywhere between 25 and 40 milligrams of CBD during the very first week of starting CBD is a safe amount. And when you do the math, 3 drops in the morning, 3 drops in the evening of our tinctures, and a gummy or 2 during the day and during the night, it's putting you around 35 to 40 milligrams. That's a safe way. Some people, that's too much. And how will you know if it's too much? Well, you may have an increase in fatigue. You may have a headache. You may be a little nauseated. So that's your body telling you don't need that much and to back down. But most people do very well. It's that rare person that only needs like 10 milligrams of CBD. It's that rare person that needs just a little bit to get what they're looking for. Most people need between 25 and 50 milligrams of CBD. Some people need between 100 and 200 milligrams of CBD. So it depends on your body chemistry. It depends on your weight. It depends on your diet. It depends on how you metabolize CBD. It depends on the severity of the situation that you're trying to resolve. It's a lot of different factors, and that's why we say start low and start slow. Great questions.
I think, yes, absolutely. And Dr. Rita, I have 2 herniated discs in my lower back. What else can I use? Hemp MD and extreme pain cream? And will Delta 8 help?
Yes, so the Delta 8 is a great cannabinoid to help relax your body. It gives you more of that physical relaxation. It's one of our newest products. So yes, I definitely would put that on board. But I would also get that Power Body Mango Cream. You know, we're hearing a lot of testimonies of folks using it, and it's helping to assist with their inflammation and pain. I've been using it, and I use a little bit of this, and I mix it with the Power Body Mango Cream, and I'm really liking the way that it's addressing this shoulder. I'm really loving that. You want to make sure that you are also doing stretches. You're doing some Pilates or yoga. You're doing stretches that's going to help strengthen the ligaments around the disc. You know, again, you cannot just think that you can use CBD, it's going to be magical. You've got to work with all the other lifestyle modifications. And when you marry all that together, it's beautiful. Many of you know that I was um, nursing a heel spur, and I did everything. I got my orthotics in my shoe, I was doing my stretches, and I was taking my CBD. Guess what? Heel spur gone. So you've got to remember that is a holistic blend of diet, exercise, sleep, water, and CBD, right? You got to work with all of these lifestyle modifications. If any of you have had a heel spur out there, God bless you. That was the worst pain. It was worse than labor for me.
Ooh.
And I am so glad that's over. That was awful.
Wow. I'm glad that you got rid of that as well. Will the MD help with nerve damage or pain? Nerve pain.
Well, remember, we can never make claims, so we don't want to fall into the way we're going to answer that. But what we do know about CBD is that it's an anti-inflammatory, it's a neuroprotective. Neuroprotective is a big word that means it helps to reduce inflammation around nerves. It helps to restore nerves that have had trauma and or nerves that have been damaged due to health conditions like diabetes. So when we look at addressing neuropathy, when we look at addressing sciatica and the symptoms that these conditions bring, yeah, there's a lot of studies that CBD has been very, very effective in those conditions. We can't say cure, we can't say it's going to mitigate any of these things, but what we can do is share the research, share the science, and then we go from there.
Do essential oils have CBD?
No, our essential oils don't have CBD, but our CBD has essential oils in it. And essential oils are part of the cannabis plant.
Awesome. How do you know what stage you're in? I had cervical ablation several years ago. No period since then. I'm 52. Is there a test?
Yeah, you can do an FSH. It's a blood test that can show the reserve of your ovary. Most women go through menopause at the age of 51 and a half years old. So if you're 52, your FSH is probably going to come back really, really high. FSH level over 40 is diagnostic in most labs for menopause.
Would you say it's safe to detox every 3 months?
Yeah, you can detox every 3 months.
I learned a lot. Great presentation. Thank you, Dr. Rita. When someone says that they have hemp, so why do they need CBD? I guess they mean, what do you say to that?
Yeah, so hemp seed don't contain CBD. So when you look at the plant, the hemp plant, the seeds part don't contain CBD. So what you would say to them is that, yes, what you have, which is hemp, is very nutritionist. There's medicinal properties and benefits, but it's not CBD.
And I just thought about another way they may mean this question when
Okay.
they're thinking about perhaps the marijuana side where there's THC, because I've had that question asked me, well, I smoke weed all the time. It makes me feel good. Why do I need CBD? What would be your answer to that?
Well, CBD has more medicinal properties and benefits than marijuana, THC. The marijuana will give you the high, but because it has trace amounts of CBD or low level and percentages of CBD, it's not going to give you the medicinal health benefits like the hemp species does. So that's why many of my patients that come to me and want a medical marijuana card, the first thing they say to me, Kathy, is I don't want to be high. And so I educate them about CBD that comes from hemp, and that's what they choose because they do want to relieve their pain. They do want to relieve their anxiety. They do want to get better sleep. They don't want to be high. So,
Great.
yeah,
So let's take one more question. You have several questions, and Dr. Rita, what address would you like them to send those questions to?
Rita MD at Wakanna.com.
All right.
RITA
I'm
MD
gonna put it in the chat for you.
is in dog at Wakanna.com.
So the last question would be, what would you suggest for seizures?
Well, CBD became mainstream because Sanjay Gupta did a special on a little girl by the name of Charlotte Fiji who had seizures. And her parents were at the point of having her undergo brain surgery because of so many seizures. So they introduced their daughter to CBD. So she went from having 300 seizures a week to three. And so CBD is an anti-seizure. It helps to relax those seizure stimuli in the brain. It's well known, CBD is well known for assisting those who have seizures. In fact, the FDA approved a CBD synthetic drug called Epidiolex for seizures. So lots and lots of research is done on CBD and seizures. So for seizures, you want to address CBD in a different way. Seizures, the research has shown, in fact, the Mayo Clinic did studies that shows that for seizure disorder, you do want a little bit of THC around. So you want a full spectrum product. You want a power product when it comes to seizures. Now, you may say this person has seizures, but they have drug screens. Well, there's no way of getting around that. They would have to use our pure product, but absolutely the studies have shown that we use a full spectrum product, that little bit of THC that helps to even lower the seizure threshold even more. So tincture twice a day, gummy at night, fast acting product whenever you need, PRN to help to reduce seizure, and also, yeah, the gummies, the tincture, and the smokable. Those are the three products, absolutely, that you want to have on board for those who suffer from symptoms due to seizure disorder.
So Rita MD at Wakanna.com. There is one more question in here that I'd like you to address. One person said that they mixed a bottle of all our tinctures we can ingest. I take the maximum drops twice a day.
I wouldn't
You have,
recommend doing that. That's something that you decided to do on your own.
okay, I thought that that would be good to address that since it's a public question.
Yeah.
So there, Dr. Rita, it is 3 minutes after the time. I know that you are extremely busy, and I want to just thank you, thank you, thank you for everything that you do for Wakanna. I mean, I know what you're doing there in Chicago, literally saving lives and then bringing life. So, sister, all up to you. I mean,
Thank
over
you so much.
8,000 babies in the United States and the Caribbean, and it's probably what, 9,000 by nine.
Absolutely. This COVID baby.
Wow.
Are we?
Kobe babies. Oh my God, they're still coming. Well, that's good though. So
Yeah.
everyone, Rita MD at Wakanna.com. If you didn't hear your question, because all of them are really good questions, we just have to give this lady back to the community, and we just appreciate you.
Oh, thank you, Kathy, so much. Remember to contact the person that invited you so you can get your products ordered. Email me whenever you like. I respond to emails. I want to thank all of you for attending, my business partners, our guests, and thank you, Kathy. Thank you, Dr. Betty, as well, being on the advisory panel there. We'll see you next Wednesday. We will have a great topic as well every Wednesday night at 8 o'clock. Good night, be well, and be safe.